Should informed consent be different for physician-assisted suicide? Imagine facing a choice that could end your life. How you decide to proceed depends on many factors, especially when it comes to ending your own suffering. Today, we explore whether the process of giving informed consent should be different for physician-assisted suicide. In most medical treatments, informed consent means the patient understands the risks, benefits, and alternatives. But when it involves ending life, the process becomes more complex. Patients requesting physician-assisted suicide must show they are mentally capable of making such a serious decision. This means they understand their illness, prognosis, and what taking the medication entails. The threshold for assessing mental competence is higher here because the decision is irreversible and life-ending. Voluntariness is also key. Patients must request assistance without pressure from family or caregivers. Usually, this involves multiple requests over time, both spoken and written, with witnesses confirming their wish is free of coercion. This extra step helps protect vulnerable patients from impulsive or manipulated decisions. Full disclosure is essential. Patients need detailed information about their diagnosis, expected prognosis, and all available options like palliative or hospice care. They should also understand the risks of taking the medication, such as possible side effects or failure to hasten death. Unlike other treatments, physician-assisted suicide involves intentionally ending life, so transparency is even more important. Mental health evaluations are often required if there are signs of depression or psychological distress. Since mental health issues can cloud judgment, assessing emotional well-being ensures the decision is made with a clear mind. This step is not always standard in other procedures but is vital here. Legal safeguards like waiting periods, second opinions from another doctor, and thorough documentation are built into laws governing physician-assisted suicide. These measures are more extensive than in typical medical treatments because of the gravity and finality involved. They help confirm the patient's decision is well considered and voluntary. Doctors have the right to refuse participation based on conscience, but they must still provide information and refer patients to other providers. This respects both the healthcare professional's moral stance and the patient's autonomy. Finally, detailed documentation of the patient's requests, capacity assessments, and consent discussions is required. This ensures transparency and legal accountability. In summary, consent for physician-assisted suicide must be more detailed and carefully managed than for other treatments. It aims to protect the patient's autonomy while guarding against coercion and impaired judgment. This approach reflects the core principles of medical ethics: respect for autonomy, beneficence, non-maleficence, and justice, especially when dealing with such a profound and sensitive decision.